Hi, I'm Dr. Mangesh Kamath. I'm a senior consultant medical oncologist, hemato-oncologist, and bone marrow transplant physician at Helios Cancer and Hematology Clinics, Bangalore. Cancer prevention is a subject that is very close to my heart. While I take pride in helping cure a lot of cancer patients and control the cancer of many cancer patients, cancer prevention is something which is very, very dear to me. If I can prevent a few individuals from developing cancer in their lifetime, I would consider it to be as gratifying as probably curing a cancer patient. So, what are the ways that cancer can be prevented? Is something that you would have seen in various videos and various forums, but I would like to convey the message to you in small and understandable points. Let me start with the favorite amongst all health professionals, that is tobacco prevention. So, let us have two situations in this: an individual who has not been exposed to tobacco at all, and an individual who is currently abusing tobacco. Well, usually the individuals who are not exposed to tobacco at all are the pre-teens and the pre-adolescents. It should be emphasized to them by parents and teachers that it would be better to not fall prey to tobacco abuse. Do not fall under peer pressure to start smoking or chewing tobacco. And those who are currently abusing tobacco should be guided by either the non-health professionals and the health professionals to quit tobacco as soon as possible. Now, what happens in those individuals whose family member, maybe an individual's mother or father, has had breast cancer or stomach cancer or any of those cancers which can basically run in families? The first thing that I would do for those individuals is to do what we call as genetic counseling. It is not an easy process. It requires a professionally trained individual to do genetic counseling. And in case that individual is bearing the cancer causing genes, then there are multiple strategies that we advise them. In fact, I have had one patient very recently whose mother had breast cancer and he carried the BRCA gene. And I did recommend the various strategies to prevent cancer in that individual. So it is possible, but it requires some concerted effort. There are also certain female individuals who may have a higher risk of developing breast cancer because their mother or their aunt had breast cancer. In those individuals, we suggest risk reducing breast surgery. You would have heard of many famous female celebrities undergoing risk reducing surgeries. So, we do recommend risk reducing surgeries for those individuals who are highly motivated to prevent cancer from occurring in them. Vaccines is not a commonly discussed subject, but there are several cancers that can be prevented by the usage of vaccines. Hepatitis B vaccine, human papillomavirus vaccine are two of the major examples of vaccine which, when given at the right time, can help prevent cancers due to hepatitis B infection or human papillomavirus infection. Cancer screening is something which is very important for prevention. Well, technically, you may not call it prevention, but detection of cancer at the earliest stage. But nevertheless, when most cancers which are detected in the earliest stage, like stage 1, are highly curable. In fact, some of the most common cancers of the breast and ovary and cervix, when they're detected in the earliest stage, have really high cure rates. So it is important that cancer screening is done by an expert in cancer screening. It is not something that can be done over a master health checkup. You need to discuss with your oncologist, the preventive oncologist, who can guide you what would be the best way of cancer screening for your exposure in life. So, cancer screening should be done. There are particular timelines and age factors which decide what is the best cancer screening method for your age and your exposure.